first time ever, we have reached 1 million children in registration, and where in all those countries where we work, all those children that are registered, they could be followed up using our system. So that, I think, is a big accomplishment that we have achieved this year, which we were working for a long time.
Our accomplishments in 2021 for the project in the Gambia directly picked up from where we left in 2020, which was a national scale-up of SBT in EPI. This should be mentioned that this is like the first African country now that has a digital immunization register. And with that said, it's like a huge impact, because if you would think a European country would be more advanced in technology, that's not the case, because like a lot of them, they do not have a digital immunization register. So one can imagine the importance of this achievement.
We developed Afghanistan at an early stage. And actually, that's kind of a thing that like really amazes me. Even though the country was like, torn apart with like war and everything, we still continue.
In Uganda, we're scaling in immunization in 30 districts, 30 largest districts, which covers almost 60% of the population.
We're quite quickly, like almost impossibly quickly, develop Honduras COVID vaccine management. It took us only like just 2 weeks from the beginning to the end to create the working prototype and introduce it. And I was so impressed by it because we actually never done something like that before.
Haiti was the first country where we started implementing logistics management information system to make sure that there is data visibility on all the medicines and supplies, based on which the medicine availability could be improved and the wastage rates could be reduced.
Further started collaboration with the RBF unit and NANA, the National Nutrition Agency in the Gambia, where we expanded the portfolio of our reports that we are providing MOH with including the RBF data validation report to our dashboard.
Manual data verification is the single biggest problem why the results-based financing are not usually sustained in many of the low and middle income countries, because the governments cannot afford to do that manual data verification by themselves. It's very costly.
What we are looking into is like establishing a central format of verification, which would relieve the regional offices from this burden to focus more on the quality of data and the data usage.
To improve the supportive supervision, to improve the quality, and to establish, most importantly, to establish a functional quality improvement system in the countries. That's why we will be soon implementing a new innovation from Shifo, which is called Smart Actions.
We have started developments on a second mobile app, which will replace the existing one.
When we developed the first mobile app in Gambia, we found some issues with that because we had an idea before that all the countries, even though they are different countries, they have absolutely the same needs, which wasn't true. We rebuilt entirely the mobile app from the scratch. So now it's works independently in every country.
It provides health workers with an option to use a fully digital solution.
Like a good thing about Shifo is that you can say this is an organization when you learn a lot. Like you can't stop this process. It's just, I don't know. It's unbelievable.